If a patient wasn't born here in the United States, do they have this right to receive care like a blood transfusion? If they weren't born here, do they have this right to receive vascular surgery, even though they weren't born here? If a patient wasn't born here in the United States, do they have this right to receive access to things like open heart surgery? I mean, if they're in my office and they weren't born in the United States, am I supposed to provide them with this type of care? Yeah, of course I am. And if a patient is in my office, I don't care where they were born. We're going to treat them. We're going to do the best that we can to provide them access to the highest quality care here in the United States. Now, when I say they weren't born here, does that make a difference if I say they weren't born here yet? Because yes, that is a key. We treat the babies in the womb as patients. They were not born in the United States yet. We are now routinely performing blood transfusions to save babies' lives in the womb, and we have done that as early as 18 weeks gestation. They can't even survive on the outside for another 4 to 6 weeks. We have routinely performed laser vascular surgery for twins that are in the womb that are not sharing the nutrition from their placenta equally. So we perform laser vascular surgery, essentially dividing the placenta in two, saying this is your side of the placenta, this is your side of the placenta. And a little over a year ago, doctors at the Cleveland Clinic had a baby in the womb that was diagnosed with a teratoma, a tumor that was almost half the size of the baby's heart itself. And if something wasn't done, that baby would die on the inside. You know, they gave the mom an epidural. Mom was comfortable. They made an incision in her belly, made an incision in her womb, and then they brought up the baby's right arm and they brought up the baby's left arm. And while they had access to the baby's arms before they did the open heart surgery, they had a pediatric anesthesiologist start an IV in the baby's hand. That baby was receiving fluids, the baby was receiving pain medicine, fentanyl, the baby was receiving a paralytic called Norcuron. This baby had its own anesthesiologist. They then made an incision in the baby's chest. They removed the tumor successfully. Almost immediately, the baby's heart started to function normally. They then took the IV out of the baby's hand. They tucked the hands back in the inside of the womb. They closed the womb, closed the skin, and 10 weeks later, at 37 weeks gestation, they did a C-section and they delivered a healthy baby boy. We treat the preborn as patients, and patients have rights whether they were born in the United States yet or not. God bless you. I'm Dr. Bill Lyle. I practice obstetrics and gynecology. If you have any questions, contact me through my website, which is prolifedoc.org. God bless you. And yes, we will fight for God's preborn in the womb, created in His image at the moment of conception. God bless you all.